So just as a way of giving a snapshot of where we are now, the first big headline is that the coming into the force of the MDR really does signify the start of a whole new era for medical device regulation in the EU. And that's because although it's more a significant update than a total overhaul or redraft, the absence of any grandfathering provisions provides for this watershed where all devices will now need to comply with the MDR if they're to remain on the EU market, even where they've already been on the market under the old legislation for some time. So although there are some transitional provisions that provide a bit of breathing room, when we look at things like enhanced requirements around clinical evidence and the new more detailed general safety and performance requirements, the MDR really does potentially amount to a significant added cost for manufacturers, including and perhaps especially those manufacturers with long established devices on the market. Related to that, then you have a second big issue, which is that notified bodies are also now subject to more onerous obligations in relation to their own activities. So not only do notified bodies now have a lot of work to do in assessing this vast array of devices that were either already on the market under the MDD or that are now seeking certification for the first time under the MDR, and primarily the upclassing of software medical devices is particularly relevant on that upclassing point. But that assessment process is now more involved for notified bodies under the MDR. And most importantly, there are now far fewer notified bodies who are certified or accredited to assess devices under the MDR than there were under the MDD. So that's created this queue or bottleneck with manufacturers now having to jostle to get their devices assessed and certified under the new regime. And added to that, then, we're still awaiting things like harmonized European standards under the MDR. New guidance from the MDCG seems to be issuing almost weekly at the moment. And although the first actor module of EUDAMED went live earlier this year, all of the various modules that will make up EUDAMED need to be operational for the system to be fully launched, which is something that hasn't happened yet. So it's safe to say that although the MDR is now in force, we're still very much in the middle of what will likely be quite a protracted bedding in process. So there's a huge amount to deal with there, but even taking the transitional provisions, that's something that became an area of focus in the lead up to the 26th of May, especially with the upclassing of so many software devices. But when you look at that issue around access to notified bodies, the grace period running up to May 2024 under Article 120 for certain devices really won't feel that long for the manufacturers of those devices availing of those provisions. So added to that, you also need to be super careful around significant changes if you're carrying on under an MDD cert for the time being. So the breathing room comes with a price, and that's a high price if you're providing an app or a piece of software, given the speed of innovation and the usual pace at which devices like that are changed and updated. Added to that, you have the requirements under the MDR around things like post-market surveillance and registering economic operators now applying. And you can see that this transitional space really is designed to be this very temporary transit point for devices on their way to full MDR compliance. Speaking of MDR compliance, I've mentioned notified bodies already, but the publication of harmonized European standards is always or already something that both industry and notified bodies are eagerly awaiting, because they can confer this coveted presumption of conformity, and the various mandates providing for the harmonized European standards that were available under the old regime expired with that old legislation. So the MDR provides for a process where the Commission requests the relevant standardization bodies to prepare the necessary standards. And in this case, there were 201 existing standards, along with a further 27 new ones that were being requested for things like phthalates, nanomaterials, and software. And unfortunately, an initial request by the Commission for those standards was rejected last May. So an amended request has gone in April of this year, and there could be further, hopefully positive news on that front any day now. While that standards request is being considered, though, we've also just had guidance on standardization for medical devices, which is coming along with a lot of other guidance. And I think we're up to over 70 separate pieces of guidance now. But really there's a lot more to come out and a lot more guidance required, especially when you look at the changes that are brought in under MDR and the lack of guidance for many of the new obligations. We frequently work with clients whose devices and apps are always, pushing the boundaries of what's possible in terms of technology-enabled healthcare. And software as a medical device is something that the MDR was really intended to address. However, there are gaps and guidance is needed. And when you're working with clients in such a dynamic space, having those reference points in the form of guidance really is invaluable. And it is challenging for manufacturers to navigate the boundaries in the absence of the appropriate guidance. So I do feel that at least when it comes to certain issues, in the absence of guidance, we are in murkier waters than we would have expected to be in at this stage. Finally, because it's something that has ended up sitting alongside MDR preparation on the agenda for manufacturers, given the timing, we don't have MDR in the UK because of Brexit, but the question is, will we at some point in the future? So at the moment, the UK is effectively still using the MDD through secondary legislation. However, the new Medicines and Medical Devices Act does contain specific provision for medical devices, and that's in Part 4. And although that legislation doesn't do anything to immediately change the existing UK regime, it does confer powers on the Secretary of State to amend or supplement the existing UK regs in due course. So when and how that happens remains to be seen. However, you would like to think that something at the very least resembling the MDR would be implemented in the UK, especially when you consider how the UK, when it was a member state, and the MHRA in particular, were quite key players in terms of driving the development of the MDR regime. Also on Brexit, you have things like the new UCA marking, and I think now at the moment, SGS and BSI would be the only UK approved bodies that can grant a UCA mark at the moment. So there may need to be some movement around the length of the grace period, around continuing recognition of the CE mark in Great Britain, or the list of bodies that can assess for compliance for a UCA mark in order for Brexit related issues like that to actually work. Thanks for tuning into this vlog. If anybody watching would like to learn more, they should visit mhc.ie and also take a look at our update article, which also contains links to further MHC content on this topic.